Hello everyone, I'm Dr.MemetIşık. Today we're exploring a critical topic, a comprehensive guide to stomach cancer, covering its types, symptoms, stages, and the various treatment options available. Stomach cancer is a severe disease. It starts in the stomach. The stomach is a vital organ in our digestive system. It helps break down food. The stomach lining is where this cancer begins. There are different types of stomach cancer. Adenocarcinoma is the most common type. Adenocarcinoma of the stomach begins in the mucus-producing cells in the innermost lining of the stomach. Nearly all stomach cancers are adenocarcinomas. Adenocarcinoma of the stomach is divided into two main classes, depending on where it forms in the stomach. Gastric cardia cancer begins in the top inch of the stomach, just below where it meets the esophagus. Non-cardia gastric cancer is cancer that begins in all other sections of the stomach. Adenocarcinoma of the stomach also may be described as intestinal or diffuse, depending on how the cells look under a microscope. Intestinal adenocarcinomas are well differentiated, meaning the cancer cells look similar to normal cells under a microscope. Diffuse adenocarcinomas are undifferentiated or poorly differentiated, meaning the cancer cells look different from normal cells under a microscope. Diffuse adenocarcinomas tend to grow and spread more quickly than the intestinal type and are more challenging to treat. Gastroesophageal junction adenocarcinoma is a cancer that forms in the area where the esophagus meets the gastric cardia. Gastroesophageal junction cancer may be treated similarly to stomach cancer or esophageal cancer. Gastrointestinal neuroendocrine tumors are cancers that begin in neuroendocrine cells, a type of cell that is like a nerve cell and a hormone-making cell, that line the gastrointestinal tract. Neuroendocrine cells make hormones that help control digestive juices and the muscles used in moving food through the stomach and intestines. Gastrointestinal stromal tumors begin in nerve cells that are found in the walls of the stomach and other digestive organs. GIST is a type of soft tissue sarcoma. Primary gastric lymphoma is a type of non-Hodgkin lymphoma that forms in the stomach. Most primary gastric lymphomas are either mucosa-associated lymphoid tissue gastric lymphoma or diffuse large B-cell lymphoma of the stomach. Rarely other types of cancer, such as squamous cell carcinoma, small cell carcinoma, and leiomyosarcoma, can also begin in the stomach. Stomach cancer can be difficult to detect early on. This is because early symptoms can be vague. They might be mistaken for other, less serious conditions. Understanding the symptoms and risk factors is crucial. Several factors can increase your risk of developing stomach cancer. Infection with the bacterium. Helicobacter pylori is a major risk factor. This infection is common. It can lead to inflammation and ulcers in the stomach. Other factors include smoking, a diet high in salted, smoked, or processed foods, and a family history of the disease. While you can't control all risk factors, some lifestyle changes can help lower your risk. Not smoking is crucial. Eating a balanced diet rich in fruits, vegetables, and whole grains is beneficial. Limiting processed meats, salty foods, and alcohol intake can also help. If you have any concerns about your risk, talk to your doctor. They can help assess your individual risk factors and recommend appropriate preventive measures. Stomach cancer symptoms can be vague and easily mistaken for other conditions. Common symptoms include unintended weight loss, feeling full after eating small amounts of food, heartburn or indigestion, loss of appetite, and fatigue. Symptoms of advanced stomach cancer, in which cancer has spread beyond the stomach to other parts of the body, may include the symptoms of early-stage stomach cancer and blood in the stool, vomiting, weight loss for no known reason, stomach pain, jaundice, that is yellowing of eyes and skin, ascites, and trouble swallowing. Ascites is the buildup of fluid in the abdomen. If you experience any of these symptoms, especially if they persist, it is important to consult a healthcare provider for further evaluation. Diagnosing stomach cancer usually begins with a physical exam and review of your medical history. Your doctor will ask about your symptoms and risk factors. An upper endoscopy is often the next step. This procedure involves inserting a thin, flexible tube with a camera into your esophagus, stomach, and duodenum. It allows the doctor to visualize these areas and take biopsies if needed. Treatment for stomach cancer depends on the stage of the disease, which refers to how far the cancer has spread. Surgery is a common treatment option. It might involve removing part or all of the stomach. Chemotherapy and radiation therapy may also be used. Phytotherapeutics and holistic therapies are increasingly being explored as complementary approaches in the treatment of stomach cancer. These modalities focus on improving overall well-being, enhancing the efficacy of conventional treatments, and mitigating side effects. Phytotherapeutics. Phytotherapeutics involves using plant-based compounds with medicinal properties to support cancer treatment. Research indicates that certain phytochemicals can exhibit anti-cancer properties through antioxidant, anti-inflammatory, and immunomodulatory effects. Curcumin, from turmeric. Curcumin has been shown to inhibit tumor growth and induce apoptosis, programmed cell death, in gastric cancer cells. Its anti-inflammatory properties help reduce chronic inflammation, a risk factor for stomach cancer. Epigallocatechin gallate, EGCG, from green tea. EGCG has demonstrated potential in suppressing cancer cell proliferation and metastasis. Regular consumption of green tea may improve antioxidant defenses. Resveratrol, from grapes and berries. Resveratrol has anti-tumor properties and can enhance the sensitivity of cancer cells to chemotherapy. Gingerol, from ginger. Gingerol, the active compound in ginger, may reduce oxidative stress and inflammation, slowing cancer progression. Silymarin, from milk thistle. Silymarin supports liver detoxification and has been linked to protective effects against chemotherapy-induced toxicity. Holistic therapy modalities. Holistic therapies aim to treat the individual as a whole, focusing on the body, mind, and spirit. These approaches complement conventional treatments to improve quality of life and potentially enhance treatment outcomes. Nutritional therapy. A diet rich in antioxidants, vitamins, and minerals can support immune function, emphasizing whole foods like fruits, vegetables, nuts, and seeds while reducing processed and carcinogenic foods can aid recovery. Acupuncture and acupressure. These practices can help manage treatment-related side effects like nausea, pain, and fatigue. Mind-body techniques. Practices like yoga, meditation, and mindfulness can reduce stress, improve mental health, and promote resilience during treatment. Aromatherapy. Essential oils such as lavender and peppermint may alleviate symptoms like nausea and anxiety. Traditional Chinese medicine, TCM. Herbal formulations in TCM may boost energy levels and support the body's natural healing mechanisms. Consult a licensed practitioner for personalized TCM prescriptions. Hyperthermia therapy. This involves raising body temperatures to enhance immune system activity and inhibit cancer cell proliferation. Integrative care considerations. While phytotherapeutics and holistic therapies offer promising adjuncts to standard treatments, they should not replace conventional cancer therapies like surgery, chemotherapy, radiation, or immunotherapy. Patients considering these options must consult their oncologists and holistic care practitioners to ensure a safe and coordinated treatment plan. A stomach cancer diagnosis can be overwhelming. It is important to remember that you are not alone. Support is available from your healthcare team, family, friends, and support groups. Learning as much as you can about the disease and treatment options can help you feel more in control. Maintaining open communication with your doctor and healthcare team is vital. Don't hesitate to ask questions, express your concerns, and seek clarification on anything you don't understand. They are there to support you throughout your journey. Remember that everyone's experience with stomach cancer is unique. Focus on taking things one day at a time and celebrating small victories along the way. Thank you for watching. If you found this video insightful, don't forget to give it a thumbs up. It really helps support our channel. Hit the subscribe button and turn on the notification bell so you never miss an update on our latest educational content. And please share this video with your friends and family to help spread awareness and knowledge. Together, we can make a difference. Thanks for your support, and see you in the next video.